Hey everybody, I'm Dr. Rob Silverman here at Florida Chiropractic Association for Performance Health, TheraBand, and we're going to talk about a real interesting topic. It's a very interesting topic to you and it's an interesting topic to me. It's all about what we call a hip hinge. So people say, what do you mean by that? Well, number one, most people do not hip hinge. The hip is a very, very mobile joint. It is a mobile joint, it's where we should move. So for all of you that start looking at your lower back patients, you're going to notice that their hips are typically tight. If their hips are tight and they're not moving, something above and below, as in joints, has to move, and that's your lower back. We get 28,000 flexions in our lumbar spine without compression or rotation before we start herniating a disc through repetitive trauma. That's 28,000. So imagine if we rotate, imagine if we have some compression, we put some weight on our back. We're gonna damage those discs very early. It's a very deleterious effect to bend, or if you will, bend at your lumbar spine. So I'm gonna try and show you how everybody can hip hinge. You see those bones right here? I'm pressing on that ASIS, push it back and hip hinge. You can tell how people move just when the patient comes in, just by the way they sit. So for instance, if they sit and they bend like that, you know they're hip hinging all day long. If they're able to sit like this, they're actually hip hinging. What I showed you before, sorry about that, is they're bending at the lumbar spine when they go like that. So it's a very easy assessment. So I'll show you a couple of things we can do. I'm gonna have Jackie come and join me. Jackie, come on in. How are you today?
Good, how are you?
I'm doing all right. And yourself?
I'm doing great.
Do you hip hinge?
I think I hip hinge.
You think you hip hinge?
I think I
Great. So you know what? Let's sit. Let's see if Jackie hip hinges. Have a seat. Nice choice. You rolled your back. Okay. Do one more thing. There's another screen you can do. Overhead squat. You cool with that? Let's go to the side. I'm going to stand here and give me an overhead squat. So let's see. Well, guess what? She's bending here and she had to move at her sacrum. So we saw a little bit of a hip hinge. Stand up. And you can take anything. I actually took the stand. You can take a dowel, you can take a broom, and I'm gonna put it in 3 spots. I'm gonna put it right here on her head, I'm gonna put it right here in her thoracic spine, and the other one's gonna be in her sacral area. And I'm gonna ask her to put one arm here and hold it, and then, you got it, the other one there. And I'm gonna ask her to hip hinge, and I wanna see if she's able to keep spot 1, 2, and 3. If she's not able to do that, we'll see the break. We'll see the break in what section, whether it be the core here, whether it be the core here, or even your head. So everybody, let's watch Jackie go. Good luck. I want you to bend forward. And I have to say that Jackie can bend forward. Look at that, spot 1, spot 2, spot 3. So stand up. And now I'm gonna ask her, do me a favor, bend at your lower back so they can see what happens. And you see the break right there. So now you're seeing a break right here. She can't hip hinge. Come back up. Do me a favor, round your shoulders first. Another movement. Look, there's the break. Head came forward. 1 inch forward in your head. 1 inch forward is 10 pounds. It's an exponential. We just had this discussion. It was just on TV yesterday morning, talking about backpacks and people going forward, not hip hinging. Same concept. So one more time. Point 1, point 2, point 3. Jackie, you do a great job. This is why you're the model. Outstanding. And stand up. So now she can hip hinge. We see that, excuse me, I won't get that, sorry. She's able to hip hinge. So what do? You retrain them, you treat them. But what's the end result? Or what's the last thing you want to do? It's great if we treat the structure that's damaged. We always want to get to system, not symptom. There are hundreds of thousands of symptoms in a body. There's a few systems. So we want to retrain that muscular system. We want to match it and balance it with the nervous system. We call that proprioception. Proprioception is that balance between that nervous and muscular system, that awareness of where you are in space. And we're going to do so for the simple reason that's going to help retrain what we call altered motor control. Altered motor control is if she wasn't hip hinging well, she was moving aberrantly, the brain's now accepted that. I want to retrain her brain after I retrain her movement and I treat the structure. So how are you going to do that? Jackie, I'm sorry, I'm going to ask you to take your shoes off.
That's all right.
Jackie, you familiar with smalling the foot?
I think so.
Yeah, so she's going to small the foot. In that, she's going to press her heel down, she's going to press her toes down, but she's not going to curl her toes because she's trying to elevate her medial longitudinal arch. By doing that, we're going to get a lot of mechanoreceptor feeds. So if you would, let's see if I can check that arch. And she's got some space, and Jackie's doing a great job. So let's go through the progressions of that when you get a chance. How are we doing? How are we doing so far? Outstanding. So let's go through the progressions. You've got a couple of TheraBand stability pads here. The blue, a little easier for her, not as much stimuli. I'm going to put them down. I'm going to ask her to stand on the stability pads. I'm going to ask her to smaller foot. Let's take a look. I'm also going to ask her to hold her core in like a brace, which we could do in another video. And she's going to stand there. And she's doing a great job. She's very stable. She's balanced her nervous system and her muscular system. Then I see that she can do that, before I'm going to set her to the next level, I'm going to do some pertuberations. I'm going to push her a little bit. You know, she didn't leave any money at breakfast, so I'm getting her back now. Here we go. And she's doing a great job. So now that we have her on the blue pads, I'm going to ask her to step off. I'm going to get the gray pads in here. Thanks for your help. I'm going to ask her to do the exact same thing and start working on that altered motor control. And here she is. She's smalling her foot. She's bracing with a 360-degree co-contraction. She's doing a great job. And she stands there. I'm going to do some pertuberations. I may even ask her to put her arms above her head. I may even ask her to pull her arms back over her head. I may even ask her to put her arms down and see if she can do it on one foot. You good with that?
Oh, we got it.
Yo, I pulled out something. Go ahead. Wow. Then I'm going to ask her to switch feet. So we're building up that proprioceptive feed. And finally, let's get to our little wobbly board or wobble board here. Now, you know, there's a rocker and a wobble board. The rocker board just goes this way. It rocks back and forth, kind of like you're on a ship. And a wobble board is more circular, so you're getting all the different planes that she can move. So this is a very high level instability. You cool?
Yep.
And we're going to get her to try and balance on that. That's going to be quite hard. And you could theoretically give her some pertuberations, but that's the highest, and I don't want to push her off for filming purposes. And now she's, great job, now she's retrained her altered motor control. We taught her how to hip hinge. We assessed how to hip hinge it. And hopefully now she's going to have the clinical outcome that we seek every day with all our patients. So if you guys have any questions, I need a shout out here for your website. Give me one. Performance Health Academy, thanks for the help. That was the camera, young lady, but you can't see her, you only get to see me. Performance Health Academy, TheraBand-.com. And any questions, always feel to reach out. Dr. Rob Silverman, always yours in health.